Hello, everyone, and welcome to the Dr. R Show. We'll be coming to your living rooms weekly to discuss various health topics with the help of medical experts in their respective fields. Meet my two very special assistants, Megan and Christina.
And I am so excited because today is leg day.
And then inhale as you lower back down.
They will be with me every week to give us tips on healthy eating and proper exercise.
Stretch and keep yourself hydrated.
So welcome to my show as we both learn together. Hello and welcome to the Dr. R Show. Today we welcome back Dr. Abrahams, Head of Renal Surgery for Urology Associates of North Texas. Previously, we discussed with Dr. Abrahams the kidneys, how they function, and the factors that contribute to kidney stones. Today we'll cover the current treatments for kidney stones and what can be done to prevent them from occurring in the first place. We'll also be discussing treatment of kidney cancer and the surgical techniques, which have come a long way technically from when I first finished my training years ago. Dr. Abrahams, welcome back to the show.
Thank you.
On your previous appearance, we discussed why kidney stones formed. After someone is diagnosed with kidney stones, naturally the next step would be choosing appropriate treatment and preventing stones from forming in the future. How does a urologist decide how he's going to treat a kidney stone once you diagnose one?
Well, it really depends on how big the stone is, where it is, and if there's multiple stones or just a single stone. So if somebody has a small stone that we anticipate might pass on its own, which a lot of stones, say 5 millimeters or smaller, would do, we usually give them medications to help with pain or nausea if they have it. And then we might give them medications such as Flomax, Rapaflo, something like that, what's called alpha blockers, to help them increase the chances of passing it on their own. Also, if they have a uric acid type stone, we might give them medication which actually can dissolve the stone where it is, which obviously would make all the symptoms go away. But for a lot of stones that are either too big to pass, or for a patient who's having too many symptoms trying to pass it, we have to do surgery. And there's basically three main treatment surgical options. The first one is called shockwave lithotripsy, and that's a nice technique invented in the 1980s. Very non-invasive treatment. The patient is sedated, a machine is brought behind their back, and shock waves are delivered, sound waves are delivered through their skin to the kidney stone, which breaks it up into tiny little particles, and they pass those over the next few days.
Now, any damage to the kidney from these shock waves? Because it's sitting and pounding on it. Does it bruise it at all, damage it in any way?
Actually, the incidence of bruising or damage is extremely low. It turns out it's a very, very safe way to deliver energy to kidney stones through the kidney. There are rare times when that can happen, but that's very, very infrequent. It's actually a very nice treatment considering it's non-invasive. Overall, about 85% successful in the right patients. So it's actually a very, very nice non-invasive treatment.
Any complications from that at all?
Well, the biggest complication would be the potential if the stone is too dense, if it doesn't break up well, or if it breaks up well but the pieces get stuck in the narrow ureter tube on the way out. And that's when we have to go to the next option, which would usually be what we call laser lithotripsy. So in that technique, we use a very small diameter but very long telescope, such as what we have here, and we put it inside the person's urinary tract while they're asleep, and we have the ability to bend around the different corners and use either a wire basket to pull out fragments or stones, and we have a tiny little laser device that can go in there and break up stones no matter how hard they are. So this is a very nice treatment. It's a little bit more invasive than the shockwave, but has an even higher success rate because we can go to different parts of the stones, and it doesn't matter how dense the stone is, we can break it up with the laser.
How do you know how to navigate it in the kidney?
We use real-time X-ray, what's called fluoroscopy, while we're in there. So we actually are looking under X-ray to see exactly where we are, and then once we hook the scope up to a monitor, we can actually see exactly where we are in the kidney.
And then in the final analysis, you can actually see the stone through this instrument.
That's right. We're actually watching it on a computer screen, and so we can see exactly where we are in relation to the rest of the kidney.
And then once you see it, what do you do with it?
Well, small fragments we would pull out with a tiny little wire basket that goes right through here. We're talking about instruments that are less than 1 millimeter in size now. Or we have a laser fiber that's about 1/3 to 1/5 of a millimeter in size that can go through the scope and actually deliver very, very high energy light waves right to the stone to break it up into tiny fragments.
Now, do you have to touch the stone with the laser, or does the light itself do it?
Actually, you have to touch the stone to the laser because one of the things that makes this particular laser very safe is that it does not transmit through water. So that's what makes it safe for the kidney. But the stone has to actually touch the laser fiber, and that's why you have to have a scope that can make bends around different corners because it does have to actually touch it.
Now, how effective is this particular treatment? Are there failures even with this?
There can be failures. The one limitation, the two limitations of this technology is, number one, you have to be able to see. So if it's too bloody or the tissue is too swollen, sometimes you wouldn't be able to see. And number two, the laser, like we said, has to touch the stone. So for example, if you have a stone that's way down or the kidney anatomy is altered, you might not be able to reach it, and you might have to do some other type of technology.
So if this fails, what's your next step?
Well, if this technology fails or somebody has too much stone to do that way, we do a surgery that's called percutaneous, which means through the skin, nephrolithotomy, which means breaking up stones. So if, for example, we can't get to it in another way, we actually make a small opening right into the kidney, right through the back, and we insert a scope that kind of looks like this. We're watching through the video that's hooked up to that, and we can actually break up stones and grasp pieces. The advantage of this is, since we're not going through the very narrow diameter ureter tube, we can actually take out much larger fragments. It's much, much more efficient because the devices to break up the stones are much, much more powerful.
Now let's talk about prevention. How do we prevent stones? How do we keep them from forming in the first place once you diagnosed it?
Well, the first thing that we need is a piece of a prior stone. That's very, very helpful to find out what type of stones they have. If they have uric acid stones, which is about 15% of the population, those we can prevent with medication. Everybody else typically has calcium-based stones. Those there's no medication to prevent those. So what we need to do is analyze the chemistry of their urine and see what the exact problem is that's forming the stones. Number one, most people don't drink anywhere near enough fluids, especially people that live in the South. Because it's very warm, you got to drink a lot more fluids. So we analyze how much fluid they take in, how much fluid they put out, and therefore we make recommendations. The typical recommendation is that a stone former needs about 100 ounces of fluid intake in 24 hours to get about 80 ounces of urine out. That's a nice statistical number whereby we see that the urine is dilute enough to not make more stones. Some people, it's not the fluids. Some people, it's what they eat. So a lot of us eat way too much sodium, and the sodium increases calcium in the urine through a little pump in the kidney anatomy, and therefore people who eat a lot of salt will make more kidney stones, so therefore we put them on a low salt diet. And then there's some more rare type of stones where we do give them other medications and things like that. And there's a few other dietary recommendations that we make, sometimes around protein, sometimes around oxalate containing foods, which is like spinach and pepper, chocolate, iced tea, those kinds of things. So prevention is mostly with fluid management, dietary management, and occasionally medications.
And now for a short break. When we come back, we'll talk with Dr. Abrahams about kidney cancer and the novel ways it is currently treated. Stay right there.